name's Jack, and my topic was spina bifida. So, spina bifida is a type of neural tube defect that affects the spine and or the spinal cord of an infant. And there are three really main types of spina bifida. You've got myelomeningocele, meningeocele, and spina bifida occulta. So, when does spina bifida occur? And it really occurs in utero after conception between the third and fourth week of pregnancy, when the spinal cord doesn't close properly. And this is a visual timeline of spina bifida. It starts at 21 days on the picture and then ends at 28 days. And as you can see, where the segments are that are not closed on the spine is typically where spina bifida occurs. So myelomeningocele is really the most serious and most common types of spina bifida, and it occurs in about 1 per 1,000 births worldwide, according to the CDC. The fluid-filled sac, it protrudes from along the spine and contains the spinal cord, and it can also present with an open back and exposing the spinal cord without a fluid-filled sac, and it causes a lot of major disabilities later in life. And meningeocele is the less severe than myelomeningocele, and all it is just a fluid-filled sac that protrudes from the spine. It does not contain the spinal cord, and it can cause minor disabilities. And then you have spina bifida occulta, which is the least severe form, where there's no fluid-filled sac present, and there may be a small gap in the spine at the spinous process, and usually it's not discovered until later in life. And these are just some visual representations of spina bifida. And as you can see, the main difference between meningeocele and myelomeningocele is the spinal cord. So the etiology of spina bifida, it really varies based on what source you're looking at. This source basically said 0.5 per 1,000 births worldwide, which varies a little bit from the CDC. In the UK, it's about 7.8 to 8.4 for males per 10,000, and 9 to 9.4 for females per 10,000, and around 3 per 10,000 in the US. So the exact cause is not really well known because of all of the different factors that play a part. So some of the modifiable causes is low folic acid and vitamin B9, which is folate. That's really the most common in what you hear. And obesity plays a really big part. Maternal obesity has a high prevalence of their children being diagnosed with spina bifida. So you have some of the non-modifiable. The biggest one is genetics and environmental pollution. And you can see over in China, they have a high prevalence of spina bifida. You can kind of point that to pollution. So diagnosis can be either prenatal or postnatal. So prenatal, one of the big ones is measuring the alpha-fetoprotein level. And you've also got two big imaging, MRI and ultrasound. And ultrasound is considered the gold standard. Then you've also got the postnatal, which is a visual diagnosis. Some of the signs and symptoms, really there are none during pregnancy unless you get imaging or have blood tests drawn. Once the neural tube defect is shown, typically they do more tests just to make sure that they actually do have spina bifida. And really the symptoms are kind of based off the subtype and classification. So myelomeningocele has the most symptoms because it's the most severe. So as they're born, or once they're born, you have neurocognitive some signs and symptoms. You have lowered motor control, attention, and movement, which all can be seen as early as 6 months after they're born. Some of the neuromuscular, they have motor dysfunction is pretty common, and paralysis is pretty common. Some of the sensories deficits, they have bowel and bladder dysfunction and incontinence as well. And they have a high risk for skin breakdown and pressure ulcers, because obviously they can't feel anything. And musculoskeletal impairments, they have a high potential for scoliosis and kyphosis and contractures of the lower extremities. And the most common special signs and symptoms is hydrocephalus and tethered cord syndrome. So hydrocephalus is really a secondary condition in which there is excess cerebrospinal fluid that builds up and applies pressure in the brain. And the best way to treat that is a shunt to be put in to control the pressure. And this actually occurs in 80 to 90% of children with spina bifida. And this is just another picture of the difference between a child without hydrocephalus and one that does. You can see the ventricles are greatly enlarged. And then finally, tethered cord syndrome is basically the spinal cord is attached or tethered down to the surrounding skin after surgical repair of the myelomeningocele. And it causes a problem because, as you can see the picture, it has scar tissue and how it's stuck down to the spinal canal. And as that child grows, it causes tension and pulls on the spinal cord. And the child can be presented with weakness and pain and incontinence because of it. And some of the treatments for spina bifida. So prenatal, you can actually have surgery to repair the herniations in utero. It's really considered the better option. And it really has been shown to reduce the risk of hindbrain herniation and decrease the risk for the mother and reduce the risk of preterm death. And the postnatal treatment is really time sensitive because the closure of the spinal cord is crucial, so there's not infection or further degeneration. And the C-section, the cesarean section, is preferred method of birth to lessen the trauma to the infant and actually reduces the risk of hydrocephalus. So there are various treatments throughout the child's life. You have orthopedic, bowel and bladder interventions, and neuromuscular. And this is a reciprocating gait orthoses right here, and it's really one of the most common for spina bifida. And speaking on bowel and bladder interventions, it's really important to get that under control because one study by Davis et al. Reported 66% of patients with spina bifida said that stool incontinence really affected their quality of life. So that just shows that it's a high importance. So the prognosis for spina bifida, it really varies based on the type, with myelomeningocele being the poorest, and because of the paralysis and the incontinence. And meningocele and spina bifida occulta are really not nearly as bad, but they still can pose a little bit of an issue. And so my conclusion is that spina bifida is really a rare and potential debilitating disease that affects infants throughout their entire life. There's no 100% cure, and really the only way of reducing the possibility of the disease is by preventative measures, which tackling those modifiable risk factors. Some further research is really needed because of the amount of data that's skewed. And there are numerous rehab treatments for infants with spina bifida, and it can improve their quality of life, and physical therapy can have a huge